Hey, welcome back. It is Colon Awareness Month, Colon Cancer Awareness Month, and we have one of our fine doctors from the Spartanburg Regional Medical System, Dr. Melanie Thomas. Hello,
Good
Melanie.
morning.
May I call
Good
you
to
that?
See you. Yes, nice to meet you.
Welcome. And every month is something, but colorectal cancer is pretty curable, isn't it?
It is if it's found early.
Yeah.
That's one of the great things about it, that it's a cancer that we can detect early and cure, yes, with surgery and other treatment if it's found early.
How much does family history have to do with when you start, or is there kind of a time you need to start?
So for
having the exam, yeah.
That's right. So for the general population, for anyone who doesn't have a lot of other family members with colon cancer, so for most people, age 50 is when we should have a first screening colonoscopy. But if you do have multiple family members on your side of the family with colon cancer, it should be done earlier than that. Usually 10 years earlier than when the first person had colon cancer.
Because Melanie, we were talking in the break, we lost a dear friend just this, this past year. He was 32.
Yeah.
Tim Bright was, and he came on the show all the time and was such an advocate for, awareness. And his thing, he was in college and his, his stomach just didn't, feel right. But he didn't, he thought, well, I'm in college, I'm probably not eating the best.
Sure.
So, kept sloughing it off to that.
So.
Go ahead.
This is pretty remarkable. Cancer in general is a disease of older people.
Yeah.
And the average age that we get colon cancer is usually in the 60s and 70s. But over the last decade, we're really beginning to see colon cancer come about in young people, 40s, 30s, as you mentioned, and even 20s. We don't fully know why that is, but we have a feeling that it has to do with two things. One, the obesity epidemic that we have in this country, and that we are, in general, people are not as active, walking, running, bicycling. We're just not as active.
No, we're not.
And those two things are, we think, what is leading to the onset of colon cancer earlier.
So you hear us preaching, eat right, try to exercise. It's not just so you look a certain way or to fit into a certain size.
Yeah.
It's for your overall health.
And let's assure people now, I've had, I guess, 3 or 4 colonoscopies, and it's relatively simple. And it tells you a lot.
It really is. I mean, I've had 2 because I had it in my family, and we have a saying, the prep is the worst part. Because
it's a drink? Is there
something?
Yeah,
you have to drink something that basically you have to clean out your colon, get rid of all the stool so that the endoscopist can see. And it takes about a day or a day and a half, you're just at home doing that, being near a bathroom. But the procedure itself, you're right. You don't remember it, you're out, you're done, and you've done a huge favor for yourself.
Now, if I know my gastroenterologist friend, Dr. Walter Douglas, is the guy that takes care of me, but do you need to go to a specialist if you want this, or start with your regular internist or family practice guy?
So your family physician, whether it's an internist or a family practitioner, should be reminding patients that you're getting to age 50, or because that's a huge part of their job is preventive care. But the procedures are done usually by gastroenterologists. Many surgeons do them as well.
Right. Well, what's tomorrow?
Yeah, tomorrow's the day we
special
got
day.
So this whole month is Colon Cancer Awareness Month, and tomorrow, March 6th, is a special day. Wear blue, that's the color of colon cancer, and to really kind of heighten awareness that that's a preventable cancer.
Are there any symptoms that we might be aware of?
So any change in anything to do with your stool. So change in stool caliber, if it gets stool gets smaller, certainly anything abnormal in your stool, so blood or something black. 1 day or 2 days of something like that is probably nothing to be concerned about. But if you're having some sort of abnormal stool pattern for many days or a couple of weeks, it's time to get
call your
checked
doctor.
out.
And you just tell them that, and they'll.
That's right.
Will they get a sample? Or?
Yeah, I mean, so it's always take a good history first. There's a lot of things in the history. And sometimes it can just be even just a sigmoidoscopy or a simple exam in the office. But, those words, something's wrong with my stool will trigger in a attentive physician. I need to work this up further.
We know this isn't the most fun thing to talk about or to think about, but this could seriously save some lives. Like, some people they don't want to deal with it because they're worried about what someone's going to say. Face it and let's,
That's right. So many cancers, we don't know what causes them. I mean, breast cancer, we don't know what causes it, but in colon cancer, we do. These come from polyps that are growing. It takes about 10 years, we think, for a polyp to turn into a cancer. So here, with this test that you're going to have, you can find those polyps early, or even if it's a cancer and it's found early, it's curable. With surgery and
be
other
smart,
treatment.
and you can go to the internet and check it out.
Yeah, Gibbs
You're with the
Cancer
Gibbs
Center
Cancer Center, which is a very important part of Spartanburg Regional Healthcare.
Right.
Thank you.
Thank you so much.
You're very informative, guys. And again, GibbsCancerCenter.org. You see a number that's right there on your screen too. Give them a call. They'd be sure to talk with you about it. So thank you, Dr. Millen. We appreciate it.